Welcome to Ask About TV. We are here today with Dr. Michael Walls, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic today is sleep. How do a person's sleep patterns reflect or influence their health?
Without sleep, there's no repair. You simply cannot repair tissues without appropriate rest and sleep. Sleep is controlled by what's known as the circadian rhythm, and that's a rhythm of the nervous system that allows for certain hormones to be secreted and certain dynamic processes to take place in the body for repair and health. Problems with sleep, either not getting enough sleep, but most importantly, not getting enough of high-quality stage 3 REM sleep, or rapid eye movement sleep, has been associated with all manner of chronic degenerative diseases, such as increased risk of cardiovascular disease and autoimmune problems, but has also been associated with simply not living as long or early death. So that's how important sleep quality is, much more important than just length of sleep.
What is the recommended number of hours that a person should be sleeping each night in order to maintain good levels of health?
Well, most people are familiar with the 8 or 9 or 10 on average hours of sleep that we're supposed to get, but that's not what's really important. If one has the time, you'd want to do some research on finding out how to identify your REM or rapid eye movement stages of sleep such that you're sleeping longer within that stage 3 REM sleep. Now, what that might mean is that some people might get away with 4 hours of REM sleep a night, and that's all that they need, while other people might need 6 hours. Or if they're deficient in REM sleep, you can't really make up for lack of REM sleep by sleeping many, many more hours, 8, 9, or even 10 hours, in the non-REM sleep cycle. So it's really confusing and incorrect to think just about the number of hours, but the quality of the sleep that one is actually getting. And that's something that a person can figure out usually with experimentation. As one example, if you find out that you're tired all the time and you're waking up at a certain time, your alarm might be waking you up right in the middle of deep 3 rapid eye movement sleep. You might want to try to set your alarm clock either maybe 15 minutes earlier or actually 15 minutes later to see if you can avoid breaking the REM sleep cycle. So that's just some of the ways to figure out how you need to sleep so that it becomes more about sleep quality and not just length of sleep. But the takeaway point here is if you're sleeping lots of hours and you're still tired, you're either not sleeping enough in a stage 3 REM sleep or you're breaking your stage 3 REM sleep cycle. And that deserves some attention.
What are some potential nutritional health problems that a person's difficulty in falling asleep can be an indicator of?
Well, a variety of health problems can create a difficult time falling asleep. Anything from depression to chronic pain. But virtually any health issue that disrupts how the body works can affect the sleep cycles. And this is a fact that is underappreciated by lots of physicians who would acknowledge that someone might have sleep issues, but that practitioner, that doctor, for example, might simply deal with the patient's health issue per se, but not understand the relationship of high-quality sleep. But to answer your question, there isn't a health problem that couldn't potentially affect quality of sleep. And on the other hand, sleep quality problems can cause and increase one's susceptibility to all manner of health problems.
What supplements or nutritional changes can be administered to aid a person who has difficulty falling asleep?
Well, there are lots of different supplements and herbs out there that have been proposed to help sleep quality. Melatonin, which is a hormone, is one of them. Valerian root, kava kava, passion flower. There are many of them. And I have found that they don't generally work. You can try them, and if they don't work for you, you might be a bit confused. But then it should occur to you that the cause of your sleep problems might not be found in a bottle of herbs. It might be because you have too much stress in your life and your stress needs to be managed. or you hate your job, or you're not exercising regularly enough, or you consume too many stimulants, either nervous system stimulants, chocolate, or caffeine, as an example, or perhaps the timing of your last meal might be activating digestion in a way that's keeping you up, or your lifestyle habits in other ways, such as watching TV in bed. That usually promotes problems with sleep over time. Also, once you do wake up in bed, many people stay awake too long in bed. But once you've been awake for more than about 20 minutes and you're trying to get to sleep, you actually, the experts say, and I agree, you don't actually leave your bed, because if you associate staying awake for long periods of time in your bed, you actually can increase your lack of sleep propensity. So there are all sorts of lifestyle habits that may need to be adjusted for improving sleep quality. Those are just some of them.
This has been Dr. Michael Wald.